that is very difficult. These are hard dollars. We can't borrow them. And to make the management of our financials in post-recession even more daunting, this is our Democratic governor who's asking us not to pass this legislation. I yield back.
Gentleman yields back. The gentlelady from California.
Madam Speaker, I continue to reserve.
Gentlewoman from California reserves. The gentleman from Ohio.
Thank you, Madam Speaker. I yield 2 minutes to the distinguished gentleman from Alaska, Mr. Young.
Gentleman from Alaska is recognized for 2 minutes.
Ask the United States arriving stand.
Without objection.
I've listened to this debate, and rarely do I come to the floor if it doesn't consider Alaska, but this also affects Alaska. I'm one that believes in health reform. But anybody can tell me on that side of the aisle with 2,700 pages, and they say the new one is not quite that long, it's 2,000 pages. And what's in the bill? They forget to say that there's 160 new grant programs that have never existed before. There is 110 new agencies, Mr. and Mrs. America, that can issue regulations. There's 13 health czars. We're making them legal under this bill. And the big thing, there's about 1,200 pages of gobbledygook. And I call it gobbledygook. I read one on the floor the other day, but this is on page 1181, a new one. In general, subject to the succeeding provisions of this subtitle, in the case of affordable credit, eligible individual enrolled in the exchange participating health benefits plan, 1, the individual shall be eligible for, in accordance with this subtitle, affordable credits consisting of A, affordable premium credit under Section 243 to be applied against the premium for the exchange participating health benefits plan in which the individual is enrolled, and B, the affordable cost sharing credit under Section 244 to be applied as reductions of cost sharing otherwise applicable program and plan, and 2, the commissioner shall pay the QHBP offering entity that offers such plan for the Health Insurance Exchange Trust Fund an aggregate amount of affordable credit for all individuals enrolled in the plan. Over 1,000 pages of gobbledygook. I have an old saying, it should have been kissed. Keep it simple. Stupid. Keep it simple. Now, I can tell you, go through this bill, Mr. and Mrs. America, and read this and tell me what you understand. I've happened to read this bill. I don't understand it. No one else understands it. And I suggest respectfully, Mr. and Mrs. America, we should not pass this atrocity.
Gentleman's time has expired. The gentleman from Ohio reserves. The gentlewoman from California.
Madam Speaker, I yield to the gentleman of New York 3 minutes.
The gentleman from New York is recognized for 3 minutes.
I thank the gentlewoman from California. Everybody on that side is throwing numbers around. The numbers I'd like to think about for a second are more dates than numbers. It seems that everything that could be going wrong in this country, according to that side, started on January 20th of last year when we had a new administration. The prior 8 years were wonderful years. We were not in a war. We had surpluses. Everything was going great. At least that's their presentation. But everything starting January 20th of last year, oh my God, that's pushing the country down the road to socialism, going into a big, deep hole, and it's the end of America as we know it. Well, the fact of life is that this bill is a good bill. It's a very good bill for our country. And I'd like to share with you some good numbers. Numbers that affect my congressional district in New York, in the Bronx, New York. But I must tell you that these numbers are reflective throughout the country. Listen to this. 86,500 uninsured residents of my congressional district will now have coverage extended to them. Medicare will be improved for 65,000 beneficiaries, including closing gaps that existed in coverage before. 201,000 families will be given tax credits and other assistance, and 7,300 small businesses to help them afford coverage. We're talking about the United States of America, the greatest country on the face of the earth. Still, we're close to 40 million people without health insurance. What are we talking about here? Trying to fill that gap and take care of these folks. Now, what was the biggest accusation we heard for the last year and a half? You're moving too fast. Too fast. President Roosevelt